Calling all breastfeeding and pumping moms, if you're looking for a delicious way to support your milk supply, you have to try Taste Cherie organic lactation cookie mixes. Created by a fellow mom and physician, these mixes are packed with powerhouse ingredients like organic oats, brewer's yeast, and flaxseed, natural galactagogues to help boost milk production. They're organic, vegan-friendly, and shelf-stable, so you can bake them fresh anytime. Plus, they taste amazing. My kids love them too. Check out Taste Cherie on Instagram or at tastecherie.com and use code Endocrine Matters for an exclusive discount. Before we get started, this is part 2 of our conversation. If you haven't listened to part 1 yet, I recommend going back to catch up. Otherwise, let's dive right in. I think it is, those first few weeks are so critical. Would you mind giving us, so pumping always, like, I think for moms who have pumped, it's always like a little bit PTSD and just nobody wants to revisit the sort of like, it's not gory, but people kind of feel like it's the gory details of pumping. But when a mom is pumping for her baby, will you tell us, like, how long does that take? And how often should she be doing it? Because I think this is something that's completely underestimated. Like, people are like, oh yeah, you can pump once at work, or like pump in the car or something like that. And it's not that simple. And if you don't, explain to us like what will happen.
So your pumping schedule, if you're exclusively pumping and not latching your baby during the day, for example, like if you're back at work, a mom should be pumping, kind of on the same schedule as she would be feeding her baby. So most newborns, well, if you're going back to work, it's probably been at least 6 weeks, hopefully, before you go back to work. But most babies in that first 1 to 2 months, 3 months of age, they're breastfeeding every, probably anywhere from 2.5 to 4 hours. And so if you're not pumping every 3 to 4 hours or sooner than that, obviously there's going to be a negative feedback loop and you're not going to produce that breast milk. So that production is going to go down. If you're going 6 to 8 hours in between pumping sessions, that milk supply your body's going to stop producing as much milk. Some moms like to pump even when they're home and during maternity leave, because it does stimulate more milk production. So sometimes what we do is we recommend triple feeds, which is basically latching the baby, letting baby feed, and then pumping after, and then feeding the baby that pumped milk. And that's really for those moms that are not producing enough milk, and just to kind of stimulate supply. Sometimes that can end up causing, overproduction, but only in certain situations do we do that. And some moms, even during their maternity leave, start to store some of that breast milk, freeze it, use it for later, or store it for sick season, later on, because it has, antibodies and things like that. So really it's different for each mom, but the stigma kind of around pumping and I get it. It's not the most fun activity. You have to sit there with your pump on and, it takes time. It's sometimes uncomfortable. The one thing I do with my moms is that I, during the first I don't really recommend pumping in the first 2 weeks, just because they're establishing that latch and everything. And plus it becomes a little stressful that, hey, now I have to kind of do pumping and on top of all the latching and the breastfeeding. But after 2-3 weeks, moms kind of get the hang of it. And I sit with them, we take the pump out of the box, we look at the flange size, I go through all the little equipment and show them, like, this is, how to use it. Have you watched a video? Sometimes it's just the fear of, the unknown, like, hey, this thing has all these pipes and things and I don't like it. And, so I think just education in general and just removing that stigma with pumping, and the right pump for, every pump is different too. But like you mentioned, if you're not pumping kind of every 3 to 4 hours, even at work, most moms, when they do go back to work, they try to stay on that schedule, but sometimes work gets in the way. There's just too many obstacles. You can't keep up, and that's where the milk supply comes down and it decreases and kind of the breastfeeding journey kind of stops at that point.
And on average, do you know, like, is there an average number of how many minutes it takes to, like, one pumping episode, how much time it should take?
I think usually on average, it's probably somewhere from like 15 to 30 minutes. So, setting up, pumping, 15, 20 minutes, washing your pump parts, putting everything back, putting your milk in the fridge or ice, your little thing. So the whole process probably takes most people take about like almost half an hour to pump. Sometimes a lot of workplaces don't have that allowance for even those 30 minutes. So, moms end up pumping during lunch or lunch break if you're in an office setting, if you have that option. But that's not enough. Like if you get into work at 8 o'clock and you're pumping at like 12, 1 o'clock, and then you're not going home till 5, driving home, you're not home till 6. It's a really long stretch in between where you haven't had that pump. And so, I find that I think a lot of moms do have that challenge where the time and just being away from work or away from their desk.
Yeah, I think that's one of the things that's very much underestimated in the workplace, especially in like a clinical setting or an outpatient setting where your patients are scheduled, right? And so you don't want to keep your patients waiting. But let's say you're working an 8-hour day. That's pumping 2 to 3 times in that window. And that's 30 minutes each time. And let's say you have the luxury of having a fridge in your office. That's great. But if you don't, then you have to go store that milk somewhere. You have to clean the stuff too. So I think that it becomes like a huge time challenge. And I think we really need to reevaluate how we view new moms returning to the workplace, especially if they have that appointment-based schedule and the volume that we're expecting them to achieve in that setting, because you're essentially asking a new mom who has a lot of stressors going on to do the same amount of work in, 3/4 of the time. And that's another stressor that's going to make her supply potentially drop as well. Or on the flip side, if she doesn't have the time to devote to that, you are depriving her and her baby of the long-term benefits. And I do think that we know that physician retention when women become moms is difficult. I think the AMA has a study that showed that 25%, is that the right number? I have it written down somewhere. There's a huge percentage of women who leave medicine within 6 years of training. So these are women who have dedicated 4 years to medical school. They've trained fully through residency. We're in a physician shortage in our country, and massive numbers of these well-trained women physicians are leaving after training because we have a old-fashioned system that isn't keeping up with the physician workforce. And so I think the reason I asked you to describe what pumping is like is because it's impossible to know before you're in it. And so let's say you're a woman physician negotiating your contract and you've never had a baby before, but you plan to start a family during that first job. I think a lot of women don't advocate for themselves because they don't know what to advocate for. Tell me kind of what are your thoughts on that, and what are some things that maybe we should be normalizing in jobs for women physicians, or how women treat breastfeeding themselves? Because the other thing is the cultural part of it, right? Like if we ourselves feel like we are doing a disservice to our work by taking care of our child in the most basic, vital sort of way that nobody else can, and we feel immense guilt about that, and we feel that the work that we're doing is more important than that, I think that's where moms get it poses a huge challenge, because once you have a child, there's nothing in the world more important than that child. I'm sorry, there's just nothing that is more important than that human life. And so when you're forced to choose, at the end of the day, mom is always going to choose her baby. And if she's not able to choose her baby, she's going to be unhappy and she's going to be resentful to the reason that she's not able to choose her baby. So I would just love to hear your thoughts on things that we could do in the workplace to support women.
Absolutely. And every workplace is very different. That's what I've learned, in the hospital setting, in different practices, even within the pediatric world. I'll just give you a little story about my own self, that when I had my third child, I went on maternity leave, and it happened right before, the pandemic happened. And I was in the process of renewing my contract with this practice. And essentially my boss, or one of the partners at the practice, called me and said, well, you will have 3 children, and I don't see you coming back full time and basically, being able to essentially see enough patients or be invested in the practice enough to become a partner in this practice. And that really, was eye-opening for me, because and she was also a female physician and female pediatrician, and that as our own, our female doctors themselves, if we don't prioritize female sort of, the things that are important to women and that should be important to women and mothers, who else will? I mean, if we are in medicine is kind of female predominant in the sense that, yes, there are a lot of female graduates, the majority, in pediatrics. I remember my residency program, I think, was like 70% women. But if we don't advocate for those rights and those things that are important, that will make, just basic rights, that, hey, female doctors should have the right to go pump during these times, or block my clinic schedule, once in the morning, once in the afternoon, I'm going to be out pumping, and then, move my schedule around. If we don't have those rights, or we don't fight for those, or speak up, then who will, and so that was pretty eye-opening, that I, didn't even have the support of another female physician who was also a mother and, also went through this. Sorry, going back to your question, I think that each workplace is very different. In a hospital setting, you do have administration that sometimes, has a lot of rules that, hey, this is going to be the allowed time or whatnot. One thing that I really, obviously, if we look at European countries and Canada, and we always do kind of compare, as far as maternity leave, paternity leave, we don't have that in this country. Our maternity leave is, if at best, 12 weeks. In residency, I was out for 5 weeks with my first child. And on my 5th week, I had people calling me, when are you coming back? We need you back in rotation. I was lucky enough to take 12 weeks with my second child. And then I was in private practice during my third child maternity leave. So I took a longer period of time. But not everybody has that option. And paternity leave is kind of unheard of in this country, depending on what kind of work you do. And a lot of us with dual physician households, we didn't have our partner even there, because they were back to work either the next day or the same day. Sometimes they were, on call or whatnot. So just that support system isn't there. I think normalizing a basic amount of, obviously I hope that our country ends up at some point getting a normal amount of maternity leave that is beneficial to both baby and mom, to create that bond. And, when baby's old enough, a 6-week-old baby is not old enough to be away from their mom, especially when you're exclusively breastfeeding. And unfortunately, that's the reality. Sometimes even sooner than that for a lot of medical professionals. They're going back at 3 weeks, 4 weeks. It's just not enough time for your body to heal, and for, to create that bond for the baby to be away from their mother, biologically even. And then the other thing is that in this country, we don't have a lot of in-hospital daycares. I've seen them here and there with some hospital systems, but even, if you're in a clinic setting or private practice, obviously you're not going to have a daycare right there in your office. But in a hospital setting, for medical professionals, and that goes for doctors, nurses, anyone who's working long hours, very rarely have I seen, and I know of a few in our area, but where the hospital has a daycare or some sort of childcare provided within the hospital where mom can actually go down physically, maybe feed her baby or see her baby during her working hours. And I think that's something that I hope that, in the future can become more normal. And then, of course, just removing that cultural stigma of breastfeeding, breastfeeding in public, breastfeeding when you need to feed your baby, you're providing nutrition to your child, and just normalizing it, that it's okay. Like, this is a normal part of the human experience, that, babies need to eat and moms need to feed their babies. So I think just removing that cultural sort of stigma as well.
Yeah, I think so. And you spoke about maternity leave. I saw a study that showed 12 weeks or more of paid leave was associated with nearly tripled likelihood of breastfeeding initiation and doubled the chance of continuing breastfeeding to 6 months. So I think we do have data that supports that maternity leave supports breastfeeding. And it's something that we need to have the conversation about. And I love that idea of in-hospital daycares. I mean, I can't even imagine how tremendously different my first year of having my daughter in fellowship would have been had I had that. But instead, it was like, there was like, we had a hospital that spanned a full city block. And there was one lactation room that if I was on one part of the hospital, it would take me 15 minutes to walk to. It wasn't heated, and I did fellowship in Pittsburgh. So it was like 40 degrees in there. And I remember I'd be wearing my coat, shaking, and like I had the pump, like obviously I couldn't be completely clothed because I had the breast pump on, like trying to produce milk for my baby. And then I had to walk up to our fellow room or like our fellow offices to refrigerate the milk and then go back to round. So this was a, 45-minute process for something that could have been facilitated much more easily. And I hope that I pumped in enough places and in front of enough people that they did something about that. Another thing that I think we sort of touched upon but didn't completely flesh out was the importance of like being close to your baby, because there's this whole idea of, oh, you could just pump. I think we've identified that pumping is not a just pump. It's an arduous process. But is exclusively pumping really the best way to do this? And does it make it harder? Of course, there's some babies with latch issues where that is the only option, but should we also be considering the importance of allowing mom to spend time with her baby?
Absolutely. So I was recently just reading, I think there's a book, I can't remember the name, but there's, in every culture, there's kind of this 40-day period of rest and recovery for mom and bonding time, whether it's in Asian cultures, South American cultures, there's across the board, there is this almost 1 month or 40-day period where mom's supposed to rest, and she should have this village of people that are supporting her and helping her. Basically, she's supposed to be breastfeeding or nursing the baby, and she's supposed to be taken care of. And she shouldn't be doing kind of other things and household stuff or taking care of her other children if she has other kids. And culturally, over time, this practice has, especially in the States, we don't have this 40-day period. And a lot of people don't have that luxury of just, being at home, bonding with the baby. And the one thing that did happen while I was in residency was that our residency program changed to something what they called baby first or something like, I don't remember. I trained in New York. So the babies used to initially, when I was in first and second year, the babies would, when the infants were born, they were taken to the newborn nursery, and where they would stay. They would all be lined up real cute in their little, in their little cribs, their rolly little bassinets, and they would stay there. And then they would take the babies in to feed with mom. Mom would rest, and then they would bring the babies back and change their diapers and whatever. So what changed was that the babies then would be staying in room with moms, and mom would breastfeed and keep the baby there, and she would change and keep the baby and spend more time with the baby in the first couple of days. There's pros and cons to that, I feel. One of the things that came from that was there was a lot more, what they encouraged and the nurses and the lactation consultants encouraged was the skin to skin. And that helps with temperature regulation for baby, glucose regulation for baby, and also helps with milk production. And that skin to skin is super important, where baby is unclothed, mom is unclothed, and baby lies, on mom or even dad. And that's supposed to help in the initial phase and even over time with milk production. So one of the things that helps when you're pumping is that if you're not producing enough, you should put baby on you skin to skin, and that's supposed to help your, hormonal regulation and help with milk production. And so if you're not with your child and you're at work, obviously you can't do that. And so, and I'm sure a lot of non-parents, if anyone's listening to this, may have heard that, when baby cries, you sometimes get that feeling of like milk let down, or if you hear someone else's baby cry, you get that milk let down. And so our, mothers' bodies do have a natural response to being close to the baby or hearing your baby or smelling your baby, and all of those things help with milk production. So unfortunately, when moms go back to the workforce, you are not physically with your child. And sometimes that can affect your milk production and breastfeeding and, pumping and all of that. But I think that, if over time we are able to kind of increase that maternity time, maternity leave for moms where they're spending a little bit more time with their child, or, even just within having that flexibility with every profession and every job, understanding and just having that understanding or awareness that maybe the first few months when a new mom or mother comes back to work and she is breastfeeding, to give her that little bit of flexibility or grace, like you mentioned. Maybe she needs to leave a little early, or she needs to, have a lunch break where she can go see her child or something. I don't know. But that really is, a cultural change that needs to happen that, I hope it comes with time. But right now where we are, it's a struggle, I think, for most working, especially for physician moms, I think, when they come back to work, and the fact that they do leave their profession, a big chunk of those very vital members of society where they could be, being productive physicians and being great doctors. Unfortunately, that is unfortunate that, you go through all this training and then you end up not pursuing your career. And some of that comes with, I think, that a lot of moms sometimes choose to work part-time or change the way they're practicing their profession or their specialty. But others don't have that flexibility or can't or whatnot. So I think it's tough.
Yeah. And I think, we always want to balance being supportive of moms and recognizing the challenges of being a new mom and a mom in general, with also not making it unpalatable for people to hire women, because we don't want to shoot women in the foot. But I do think, there is this window that is actually rather brief. Like the first year-ish of a child's life is actually very short. And so if we can support women physicians in those critical times, I do believe we'll build loyalty. And physician recruitment is very challenging and expensive. And so I think that if we can build goodwill, then I think we have had many economic studies on this showing that actually supporting breastfeeding can help a company economically. So I think that's something that we need to consider, that, okay, this is a temporary window where we can support something good, we can do good and support our employee or our our partner or whatever the situation is, our resident, to hopefully generate goodwill for further recruitment. Doctors talk to each other too. So if they're like, oh yeah, this place was great for me, really supportive, then that'll help recruitment and also help with further future loyalty. So you're not in this cycle of just losing people and losing a workforce that's so vital, like Alia mentioned. Alia, have you ever heard of the motherhood penalty?
Yes, I have. I think it's when you become a mother, I guess your income or your, whatever, you're basically punished for being a mother, right? Like in the workforce. So I have briefly, yes, heard of that.
Yeah, so basically it's this sociological phenomenon that when a woman has a baby or becomes a mother, they are perceived as being less committed, and they face decreases in pay, benefits. They're seen as less competent, and it's thought that with each child, a woman gets a 4% pay cut compared to something that's called the fatherhood bonus. So the fatherhood bonus is that when a man has a child, he all of a sudden it's flipped. He's thought of as more competent, more committed, and men actually get a 6% increase in pay for every child that they have. As I was researching for this podcast, I found this work by Paula England that I think our listeners would love to read on this. And it's something that I think that we sort of know intrinsically that this is true culturally, but is hard to believe still. But what do you think about that? Do you think that's real? Have you experienced it? Just would love to kind of hear your thoughts.
I think I touched on this a little bit when I mentioned my previous employer. When we were renegotiating my contract to come back to work, she basically, told me, like, you've got 3 children now. I don't see you being fully committed to this practice. So that's my personal experience with that. And I think that overall, in every specialty, in every field, that's definitely the case, especially when, we are in some of the male dominant specialties. I think I don't have any personal experience with this, but as far as like orthopedics and general surgery and a lot of these procedural long hour kind of specialties, I think female physicians sometimes are looked at as, hey, now she has a child. I don't know how committed she's going to be, or is she going to be able to physically keep up with some of the sort of physical challenges of some of these specialties as well. So unfortunately, that is the case, I think, across the board. But as far as, that was my personal experience with what happened. But I think that as more and more female physicians enter, our medical specialties, I think that this mentality has to change. We can't, kind of be biased against a doctor or physician just because they are a mother or parent. Or, in fact, I feel that when you become a parent, I think your perspective on life really changes. I think you become more compassionate. I think I read a study once that female surgeons have, this is obviously very broad, but I don't remember exactly what the study was, but female surgeons have better outcomes in some specialties, or maybe all of them, I don't know. So I don't know. I think that once you become a parent, your perspective on life changes a little bit. You do become, you're more empathetic. You see the world a little bit differently. You're not, your center of your world isn't yourself anymore. It's another human being. And so I think maturity comes with that, responsibility comes with that. And I don't know. That's what I personally believe, that I think it changes you and grounds you. And hopefully, I think it made me a better doctor. It definitely made me a better pediatrician. And it gives you experiences that help with, in my case, it helps me kind of connect with my patients and give them my experiences, like this is what worked with my child, as well as giving you the perspective as a parent, as well as, you're not just the doctor, but you've been through it too. So, hey, I understand.
Yeah, that empathy is huge. And I don't know about the female surgeon study, but there was a study, a Harvard study, that demonstrated that hospitalized patients taken care of by women physicians, when adjusted for hours worked, were at lower risk to die. So there is a lot of data now coming out that there is value in women physicians. We bring something to the table. Mothers bring something to the table for women, especially for women patients. A lot of women patients prefer women physicians. So there's an absolute vital role that women physicians play in our community, and we're important to the physician workforce and for providing care to our communities. And it's not that male physicians aren't great either, but we do provide something unique and different that is better for some patients, especially those who relate to us in different ways, as far as being a woman or a woman of color or different ethnicities. All of those things matter when you're a patient getting care. You want somebody who you connect with. And so I think it's really important for us to find ways to keep all women in the workplace who want to stay in it, and understand that there are women physicians who leave even though they want to stay because they can't find a happy balance between their work and their home life, because we know that women are still doing the majority of child-related duties as well. And I think the statistic is above 80% for both stay-at-home and working moms. So it is an important conversation to have. And I also think that I hope our generation of women physicians is changing, but I think the previous generation, they worked so hard to get where they were. And I appreciate that. And I'm so grateful that we can stand on the shoulders of what they did to work like men did in male-dominant fields. But I think it has led to a toxicity in the culture that they have created for women behind them, in that they're like, well, I did it. It was hard for me, so I should make it hard for you. I think it's important for us as women physicians and in leadership roles and as practice owners to say, hey, it was really hard for me. How can I make it better for you? And how can I support you so that you can stay and blossom and grow and create a wonderful environment for yourself and your family? So, and your patients, obviously. And so I hope that together we can kind of lead other women to that, and other women physicians to work in conjunction with each other, as opposed to like kind of beating each other down. I feel like that's kind of the sentiment we get from some of the older physician women. So as we wrap up, I was just wondering, is there anything that you wanted to say that you didn't have a chance to say, or anything that you have as a message to new physician moms or physicians who want to be moms to help them advocate for themselves on their breastfeeding journey?
I think we touched on majority of kind of everything I wanted to say, and we talked about a lot of different things. I think just ending on a note that, I think it is a cultural change. I think in the workplace, in the hospital setting, in our training programs for new moms, physician new moms, it is a shift in culture that needs to take place, that we need to normalize breastfeeding, that this is something that happens, that this is part of the world. It's a normal thing. And just to give those new moms a little bit of support and flexibility, so that and also to touch on breastfeeding is also like preventive, right? Like in the long scheme of things, when we talk about preventive medicine, doing things, as adults, we are now more aware of, exercise and lifestyle changes that we make for our own selves, the foods that we consume, and so many things. And a lot of people are very hyper-focused on health and all of those things. But overall, in the scheme of things, breast milk is actually extremely beneficial to the next generation of kids, children, that are going to come. And if we don't establish it, or if we don't, sort of make it a priority, that would be kind of sad that we don't take that full benefit. And so just as as a society, as we're changing into a more healthier, preventive society, we're focusing on preventive health. Part of that is breastfeeding. And I hope that is given the importance that it deserves.
Yes. Oh my gosh. Thank you so much for being here with us today and for everything that you said, especially that last piece as we talk so much about lifestyle medicine after the fact. I mean, there's so many things that we can do for our children and for the next generation in utero and with breastfeeding that I don't know that people know enough about. So I think that was a great point. So thank you very, very much.